Every year there are people who get pregnant. Every year there are people who breastfeed. So this topic is breastfeeding and fasting, and then also pregnancy and Ramadan fasting. This is very, very sensitive topic, and it's also individualized topic. There is no yes or no answer to this question, and there is no a set on stone answer. Every pregnancy is different. So pregnancy is totally individualized event. In Islam, Allah tells us in the Quran that a mother should breastfeed her baby recommended to breastfeed her baby until the age of 2 years. That is something that as women, Muslim women, we pay attention to and we strive to really accomplish. When we have a baby, we strive to accomplish nursing our baby until the age of 2 years. If nothing is wrong, if we are healthy and we are producing the milk as much as possible and the baby is latching properly and all of that, we strive as much as possible to nurse the baby until 2 years. But sometimes things happen and a lot of women are not able to, and that's okay too. That is totally okay. You do what you can do. The best thing is to just try. But sitting down not trying is also a problem. So as far as you try, Allah knows your intention. The opinion of scholars in Islam also is that women who are pregnant are classified in the category of the ill person. Even though we know that pregnancy is not a disease. Pregnancy is just a normal physiological event, right? But sometimes there are complications that come with pregnancy, with some pregnancies. Some pregnancies come with some complications like morning sickness, like nausea and vomiting, like constipation, like preeclampsia, maybe pregnancy-induced hypertension, like pregnancy-induced diabetes. There is a whole bunch of complications that come with pregnancy. So the ulama classifies pregnancy as the category of illness. When you are pregnant, your nutrition is vastly important. One of the things that your pregnancy depends on is your nutrition and how nourished you are. So if you find yourself pregnant and you are really not nourished, then it's going to be a problem with your pregnancy. Possibly not, possibly yes. But as your pregnancy progresses, you see that there are concerns that would arise, that your doctor would be like, you have to increase your nutrition, you have to increase your calorie, you have to watch what you eat. The same thing happens when you are overeating or when you are eating foods that are not healthy for the baby, foods that are not healthy for the growth of the baby. Right? So that happens, and then the doctor would recommend, or your midwife or whoever your health professional is, would caution you to watch what you eat, because nutrition is one of the things that we control. There's a lot of things that happen when you are pregnant. We cannot control that because that is for Allah. Allah controls that. But what we can control is our nutrition and our stress and how we take care of ourselves, our du'as, and then our hopes and all of that. We have high hopes that Allah is going to make things happen. It's going to make things easy. It's going to make things not complicated. So one of the things that we can control is the nutrition. And then we know also that in literature, in scientific literature, if a woman's nutrition is not on point, there's some complications that happen. Like a lot of the times there is like the baby would be like low birth weight, and there is some, maybe your placenta would not grow in a way that is supposed to grow, because all of those things depend on your nutrition. And then your nutrition also supplies your body to be able to produce enough blood, because you need to, your body, when you're pregnant, your body's need of blood increases. So your body starts to produce more blood. Your body starts to produce a lot of hormones, and hormones are dependent on your nutrition. Hormones are dependent on the protein and some fat that you eat, right? So it's very, very complicated. A lot of things happen when you are pregnant. As a pregnant woman, it is very important that you pay attention and you sit down with yourself, even if you are feeling okay, you feel like your pregnancy is fine, you don't have any complications, you don't have anything going on. You have to like really assess what is your nutrition before you got into pregnancy. So if your nutrition is a very varied nutrition, you eat a lot of vegetables, you eat a lot of fruits, you make sure that you hydrate enough, you are not dehydrated before you got into pregnancy, you are really eating all of the other nutrients, the major nutrients and the macronutrients and the micronutrients, you are paying attention to all of those things before you got into pregnancy, then there's likelihood that you are well nourished, right? So you have to ask yourself, what was your nutrition before you got into pregnancy? If your nutrition wasn't on point before you got into pregnancy, then it's a question mark. Is a question mark because there is a lot of big events that would happen down the lane. Okay, the first trimester requires different nutrition. It requires different nutrition for you, your body, to build up the muscle, for your muscles and the fat tissues and all of that to start producing the milk. Because once you get pregnant, that is when the milk starts to produce, right? You start automatically to start producing the milk, but the milk is not being released until you give birth. Right? So you need all of those things, the fat, the carbohydrates, the hydration, the protein, especially. You need the salt, that's the sodium. You need potassium, you need magnesium, the minerals. You need all of those things. So if your nutrition is not on point before you got pregnant, ask yourself, when you got pregnant, did you go through morning sickness? Did you go through the early signs of complications of pregnancy, like morning sickness, nausea, vomiting? Did you vomit too much? Because vomiting too also deprives you from nutrition. As the more you vomit, the more the nutrients comes out, maybe some of the nutrients, not all, but your hydration is also questionable. Because when you vomit, you lose water. You become dehydrated, right? So too much vomiting during first trimester or in pregnancy is a concern. You need to tell your doctor or your midwife so that they give you appropriate recommendation how to hydrate yourself properly. So you have to ask yourself those questions. If you really want to fast during Ramadan, these are the questions that you have to ask yourself. Before I got pregnant, my nutrition, how is it? And then when you got pregnant, did you go through morning sickness? Did you go through all of those things? If the answer is no, then as time goes on, when you get to the second trimester, you see that you start to have a very big appetite. So that is because your baby is growing very, very fast. The muscles and the tissues are growing very, very fast than when it was in first trimester, very slowly. And it's just the organs and the other stuff that are growing, right? So now the muscles and everything is growing and your baby needs that nutrition. It depends on you. And then also the placenta that is being produced by the pregnancy, it also depends on your nutrition. So you ask yourself that, right? That how is it going to be? Do you really have the nutrients stored? When you move into your second trimester, how is it going to be? And then when you get to the third trimester, it's not only that you would have a big appetite, it's also that your body would require extra nutrition to get ready for birth and labor. Your body will require extra nutrition, extra hydration, extra minerals, extra electrolytes, okay, to get ready for birth and labor. So if you assess yourself with all of these questions, that are you ready for that? Are you replenishing your body with that? Are you nourishing your body with that? Then if all those answers are yes, then you can ask your doctor and make sure that your doctor is on point, understands what Ramadan fasting is. Ramadan fasting is when we stop eating from dawn until the sunset, right? So it depends on where you are, your geographic area. If you are, for instance, in an area that maybe in Africa, like Ghana, for instance, people fast maybe 12 hours or 11 hours, I think. So from maybe 4:30 or 5 o'clock in the morning until 6 or 6:30. So that is about 12 hours or 11 hours. But in the West, that is in the UK and in the United States, people we tend to fast for longer hours, especially when it's in the summer. Okay, so it's like 16 hours, sometimes 16, 17 hours. Is very, very long. So where is your geographic? Where are you? So if you are maybe in Egypt, and Egypt is in Africa, and it's not like a long fasting hours, then you ask yourself if you can go with that. And then you also make sure that your healthcare team know about that and they understand what Ramadan fasting is. How long is it? There is no drinking, there is no eating, right, during the fasting window. So they know and they can recommend you based on the growth of your baby, based on the growth of your placenta, based on your weight that you are gaining, or based on the weight that you are losing, right? So very, very sensitive topic, but it's also very important that we discuss that. And you also, if you like really thinking about fasting, you have to pay attention and ask these questions that I mentioned earlier.